Our next guest is Dr. Angel Chu, an infectious diseases consultant at the Foothills Medical Center and clinical assistant professor at the Cummings School of Medicine at the University of Calgary. Dr. Chu has a special interest in vaccine-preventable diseases with a focus on adult immunizations and currently serves as the vice chair of Immunize Canada. Today, Dr. Chu will be speaking about why we can't forget about the flu. Welcome, Dr. Chu.
Thank you very much. It's a pleasure and an honor to be here. And with that segment, thank you very much, Dr. Hu, for kind of, bridging the introduction into my part of the talk. And I agree with everything that Dr. Hu said. There's a lot of talk about the flu and why the numbers are down, and there's many, many reasons for that. But we'll kind of talk about, the fact that we can't forget about the flu because it's not going to go away anytime soon. And so the objectives for this presentation are really to discuss the impact of COVID-19 on high-risk Canadians, and then we'll understand reasons why we can't forget about the flu during this current COVID-19 pandemic. So I'm sure we're all familiar with the statistics now, and this is reported by the Public Health Agency of Canada, looking at the age groups of Canadians who have been infected with COVID-19. And you can see that Canadians of all ages, whether it's the childhood population all the way up to adults, mid-adults, and into our older adult population, pretty much every age group has been infected with COVID-19. Now, as the pandemic has worn on since the start over the last year or so, we've seen changes in the proportions of these age groups being affected by COVID. Initially, in March of last year, most of the COVID-19 infections were seen amongst older adult Canadians. But now, as societies and schools have opened back up and as we've gone back to work, we've seen a shift where the younger population, including our pediatric population as well as the adult population, have more and account for more of the COVID-19 infections. But currently, as of the end of January, it's estimated that about 21% of all the total COVID-19 infections in Canada have occurred in the 60-plus age group. So a very small proportion. But instead, what we're seeing is that despite only 21% of infections being found in adults 60 and over, we're finding that these are the groups of Canadian adults that are being most seriously affected by the serious outcomes from COVID, where in the groups of adults 60 plus, they account for about 70% of all the hospitalizations, 60% of the total intensive care unit admissions, 97% of the total deaths seen in Canada. And of those, 72% of the deaths have occurred in long-term care facilities, as well as retirement homes across Canada. So we certainly see that it's the older groups of Canadians that we're seeing disproportionately being affected with COVID-19. And so in this graph here, you can see that even though we're seeing a lot of infections in the younger group of adults and our pediatric population, it's the fact that the older one gets when they get COVID, the more likely they are, unfortunately, to die from COVID-19. And this is a very similar trend to what we see with influenza as well. So along with age being one of the most significant risk factors for getting serious COVID-19 disease as well as deaths, we see that there's other comorbidities and illnesses, including things like cancer, chronic kidney disease, obstructive lung disease, being immunocompromised, obesity, having heart conditions, sickle cell disease, as well as diabetes. Those are some other risk factors in addition to age that will elevate somebody's risk of getting severe COVID-19 disease. So while we're all very much, still entrenched within this COVID-19 pandemic, let's not forget that there are still other leading causes of death that kill Canadians every year on an annual basis in large numbers. And these other diseases and illnesses don't go away just because of the pandemic. So from Statistics Canada, we know that the top 3 killers of Canadians continue to remain cancers, heart disease, and strokes. But if you look lower down on the list, the 8th leading cause of death in Canada is influenza and pneumonia, where these 2 infections alone are some of the 2 of the most lethal infectious diseases that kill Canadians on an annual basis. So let's not forget that. And when we look at influenza, influenza has the same ability to cause pandemics just like COVID 19 has. And if you look throughout the history of time, influenza has caused numerous pandemics over the last few centuries. The most recent influenza pandemic occurred in 2009 with the H1N1 swine flu pandemic. And by the end of that pandemic, it was estimated globally to cause close to 284,000 deaths worldwide. So let's make no mistake, influenza is just as bad as COVID and has the ability to cause pandemics just like COVID can. So we've all seen the news, and Dr. Who touched on this in his earlier segment, where this year we've seen exceptionally low flu activity despite continued monitoring across Canada. So it appears that the flu has disappeared. But in fact, it hasn't. And influenza is still circulating. It hasn't gone away, and it will not go away. And it's, as Dr. Who said, why has the flu, why are we seeing such low flu activity this year? Well, it's because the same infection prevention measures that we're using to try to bring down COVID cases and stop transmission are also effective against influenza, because the mechanism of transmission of both COVID and influenza are very similar. It's spread through droplet transmission. So the same infection prevention measures that we use against COVID, including things like social distancing, hand hygiene, avoiding touching our faces, staying home when sick, disinfecting surfaces, and in particular, frequently touched surfaces. And the most important thing is taking care of the elderly, the vulnerable, and those with chronic conditions. These same measures that work against COVID are also highly effective against influenza. And that's why we've been able to see record low levels of influenza activity. And also the importance of vaccines. So Dr. Who mentioned that with this year, the governments have procured more doses of influenza vaccines, and we have seen an increased uptake of flu vaccines, and that may also be contributing to why we're seeing record low numbers of influenza. So make no mistake, this year is an exceptional year for low levels of influenza, but it doesn't mean it's gone away. It doesn't mean we can forget about it, because we know that annually influenza causes significant morbidity and mortality amongst Canadians. Where in 2019, 2020, just before the pandemic of COVID came to Canada, it was estimated that there were over 55,000 cases of lab confirmed influenza, over 2,400 cases of hospitalizations, 300 ICU admissions, 100 deaths, and 609 influenza outbreaks in long-term care facilities. And this is just 1 year alone. And this is a consistent trend that we see every single year with influenza. And another consistent trend is that every year when we look at those Canadian adults that are being affected by influenza hospitalizations, we again find consistently that it's adults over 65 that are being hospitalized for the flu, and that's reflected by the orange line here. The next highest population of Canadians that are being hospitalized are children less than the age of 4. But even though we see a lot of hospitalizations from the flu amongst children, thankfully deaths that occur from the flu in children are still very low. But instead, what we see is that it's the seniors over 65 that are being hospitalized, and they are more likely to die from the flu as well. So very similar to what we're seeing with COVID is that adults over 65, even though they represent only 17% of the Canadian population, they account for 62% of the total hospitalizations due to influenza, along with 78% of deaths. So again, we can see that very similar to COVID, that adults over 65 are disproportionately being affected by influenza. And not only that, but we find that those with chronic medical conditions are more susceptible to dying from influenza as well. So if you're over the age of 65 and somebody has chronic heart disease, their chances of dying if they get the flu are 5 times higher than somebody who doesn't have heart disease. And it's 12 times higher if they have chronic lung disease, and 20 times higher if they have both heart and lung disease compared to somebody over 65 who doesn't have chronic heart and lung conditions. So it really is imperative to take all measures to prevent the flu in our adults over the age of 65. And one of the most effective ways to prevent the flu, or in addition to those other infection prevention measures, is of course vaccines. So even though we talk about the importance of influenza vaccines for Canadians, and in particular for adults over 65, we find that with the flu vaccines, it's not a one size fits all. And there are many, many different flu vaccine options, because we know that if we give the same flu vaccine to somebody who is older than 65 compared to someone who's less than 65, we find repeatedly that those adults over 65 will have a reduced vaccine effectiveness. So it's not the same vaccine, and it doesn't have the same effectiveness as somebody who's over 65 as compared to less than 65. So that's why we need different vaccine options for different age groups. And one of these vaccines is a vaccine called Fluzone Highdose, where all they do is they take the same standard dose of the regular flu vaccine that they give to everybody, but this vaccine formulation quadruples the concentration of the antigen. And by doing that, they were able to have better protection against adults, where compared to the standard flu vaccine, they find that this high dose formulation is 24% better than the standard flu vaccine in adults 65 and over, and it's 32.4% more efficacious in adults 75 and over. So it means that if you take, and vaccine effectiveness will vary depending on the year, but just for simplicity's sake, let's say that for that year, if the flu vaccine is going to be 50% effective, if we use the high dose flu vaccine for somebody who's 65 and over, we add on 24.2% better efficacy on top of the 50%. So that means that that flu vaccine is now going to be 74.2% effective against influenza, as well as the influenza outcomes. So because of the higher efficacy for adults over 65, and because of how COVID was disproportionately affecting adults over 65 in Canada, the Canadian government, the federal government this year, for this past 2020-2021 season, decided to use the high-dose influenza vaccine in various groups of adults over 65. So Ontario currently has the most expansive program where they offer this high dose formulation for all of their citizens over 65, whereas many other provinces have used this high dose formulation in their long-term care facilities, because these are the most vulnerable and susceptible group. And of course, we've seen so many outbreaks of the flu occur in long-term care facilities. And then this year, because of the COVID pandemic, really spotlighting and shining the spotlight on how adults over 65 are being disproportionately affected by COVID, then the Canadian government has purchased and utilized in other provinces this high dose formulation for use in other long-term care facilities. Now, we don't know if this program will continue on, and we don't know if the federal government will continue to purchase this vaccine and use it in long-term care facilities or expand the program further. It is my sincere hope that they do, because this is a far superior and a far better vaccine for our most vulnerable population over 65. So in summary, we know that COVID-19 and influenza disproportionately affect adults over 65, and we cannot forget about the risks of influenza and the best ways to protect our vulnerable Canadians against the flu. And really, vaccines are the most effective way to protect our Canadian population. And with that, I'll be happy to take any questions.
Echo what you said around high dose and the importance of government funding this vaccine, because we know that cost can so often be a barrier for older adults, for anyone for that matter. And at C.A.R.P, we've also done a lot of work around advocating that the high dose flu vaccine be administered through pharmacies as well, which currently it's not. And I'm sure you probably would support such a position, would you not?
Yes, absolutely. So we're very fortunate in Alberta, where our pharmacists can not only administer vaccines of all sorts, not just flu vaccines, but they also have the ability to prescribe it. But as you mentioned, there is the barrier of the cost of the vaccine, of course, which is always problematic for all individuals. But yeah, so in Alberta, we have the added advantage of having our pharmacy colleagues help reduce those barriers further and improve access to vaccines. And it is my strong desire and hope that that it can be expanded and pharmacy colleagues across Canada can help with that access as well.
Absolutely. Now, I do want to ask, because you're an infectious disease consultant, I have to ask about the COVID vaccine. We've seen all these new variants. We know that some are more transmissible. What do we know about the severity? Or, do vaccines become weaker as they mutate? Do they become stronger? What do we know there?
Yeah, that's a great question. And I think that's always a moving target. I mean, all of these COVID vaccines that are coming out, all these variants that are being reported, I mean, it seems like every day there's new information about them, and we just continually learn more. So, scientists and researchers are continuing to investigate that to see if the currently approved COVID vaccines will be effective against these variants. So far, depending on the vaccine, there's mRNA vaccines and then there's the viral vector vaccines by different manufacturers. It seems that there is benefit and efficacy. We just don't know how efficacious they will be or how long the protection will be for. We know that from preliminary studies that it seems that the current vaccines aren't as effective against these variants. It is reduced, but not by a significant quantity when it comes to the mRNA vaccine. So it's still recommended, strongly recommended, that all Canadians, regardless of the variants being reported, to just get their COVID vaccine when they become eligible.
All right, Dr. Chu, thank you so much for your time.
Thank you. Have a great day.